Epilepsy is a brain disorder. It causes seizures. Seizures are bursts of electrical activity in the brain. They can cause a variety of symptoms. These include convulsions, loss of awareness, and strange sensations. Many people with epilepsy can control their seizures with medications, but some people have drug-resistant epilepsy. This means their seizures don't respond well to medication. Drug-resistant epilepsy can be very challenging to live with. Fortunately, there are new treatments for epilepsy that offer hope. These treatments go beyond traditional medications. They provide new ways to manage seizures and improve quality of life. In this essay, we will explore some of these cutting-edge treatments. We will discuss their benefits and potential risks. These treatments offer hope for people with drug-resistant epilepsy, but it's important to remember that every case is unique. What works for one person may not work for another. It's crucial to talk to your doctor. They can help determine the best course of treatment for you. The ketogenic diet is a special diet that can help control seizures. It's a high-fat, low-carbohydrate diet. This means you eat very few carbs. Instead, you eat a lot of healthy fats. This diet forces your body to burn fat for energy instead of carbohydrates. This metabolic state is called ketosis. How exactly the ketogenic diet reduces seizures is still being studied, but it's thought to work by altering the brain's chemistry. This can reduce the likelihood of seizures. The ketogenic diet has been shown to be effective for some people with drug-resistant epilepsy. It can significantly reduce the frequency and severity of seizures. However, the ketogenic diet is not without its side effects. These can include fatigue, constipation, and nutrient deficiencies. It's important to follow this diet under the close supervision of a medical professional. In some cases, surgery may be an option for treating drug-resistant epilepsy. This is typically considered when seizures originate from a specific area of the brain. One surgical option is called focal resection. In this procedure, surgeons remove the small portion of the brain where seizures are thought to originate. Another surgical technique is laser ablation. This is a minimally invasive procedure. It uses a laser to target and destroy the seizure focus. Laser ablation is a newer technique. It is often associated with shorter recovery times compared to open surgery. Both focal resection and laser ablation can be highly effective in reducing or even eliminating seizures. However, as with any surgical procedure, there are risks involved. These can include infection, bleeding, and neurological deficits. Neuromodulation therapies involve using devices to modulate brain activity and prevent seizures. Vagus nerve stimulation, or VNS, is one such therapy. It involves implanting a device under the skin of the chest. This device sends electrical impulses to the vagus nerve, which then transmits signals to the brain. These signals can help regulate brain activity and reduce seizures. Deep brain stimulation, or DBS, is another neuromodulation technique. It involves implanting electrodes into specific brain regions. These electrodes deliver continuous electrical stimulation, which can disrupt abnormal brain activity that leads to seizures. Responsive neurostimulation, or RNS, is a more targeted approach. It involves implanting a device that monitors brain activity. When it detects abnormal patterns that may lead to a seizure, it delivers electrical stimulation to interrupt the seizure before it happens. These neuromodulation techniques offer new possibilities for managing seizures.